What would you often do for people who come in as a type 1 or a serious type 2 diabetic into your practice?
The first thing is you got to understand a little bit about what diabetes is. Everyone thinks of it as the sugar's gone bad. That's the last thing to happen. The first thing to happen is you begin to lose organs that are working right. Basically, everyone knows that there are cells in the body that produce insulin. They're called beta cells. They're in the pancreas. They're in something called the islets of Langerhans. That's all the anatomy I'm going to talk about. But these are the situations that are going bad. Now, there's two types of diabetes. Type 1 is we think in some way there is an immune system problem that is playing a very deleterious role in killing off the cells that produce insulin. That's the same mechanism as type 2 in basic terms, but type 2, it comes from a different source. It's being worn out by something called insulin resistance. So let's go back to the type 1 first. Immune system, something's going wrong, and we'll settle with that. There's probably other things that happen. But the amount of insulin that's put out begins to fall. You don't feel it. You don't feel anything, but it's going. Now, if you're a 6-year-old child or a 2-year-old child, you can be getting this, but you still don't feel anything. You're running around doing too much trouble and all the other things kids do, and nothing changes. But it's going down in terms of insulin production steadily. And so you're in a place where you're doing just fine because the body has a lot of redundancy. It has enough insulin to keep going. But also the delay in the release of insulin is occurring because it can't make it fast enough. So all these things are making only the place where it's making insulin change. Now what's happening also is, and this isn't a big deal, but if you were subtly looking at people, you'd find out that the child needed longer naps perhaps, or something else that said the energy levels aren't really what they should have been. And maybe even there would have been a growth spurt. And the growth spurt all of a sudden, makes things and makes them more tired, and everybody thinks, well, that's the reason they're tired. And the growth spurt might be responsible, but it's at least associated with making the fatigue. So the type 1 goes in there, and as you add in all the Pro-Arginine Plus that you have in the vitamin D, all these things give the body metabolism strength again. But when you get about 90% of the beta cell mass lost, you can't make it up with all the arginine that you can possibly take. It's there. The sugar's up, the metabolism's terrible, it gets more acid, not alkaline, and it's a situation where all of a sudden you need insulin. You need to get into a whole new routine, which is excellently done with the allopathic medications, the insulin and all the rest. We have a series of new things that are mostly for type 2, but we've used them all for a lot of type 1. Well, how would I do that? Well, as I said about the type 2, here's a situation where you're also losing the beta cell mass. But this time there's a strain by other things going on in the body that's pressing down on the insulin that you're making. And it's so tough to make the insulin, and it's so tough to make it work for people that you get exhausted, really exhausted. And a lot of people say, I'm so tired. Why am I so tired? I passed all my tests. But you're on your way to diabetes, and there's not a good way that we have to say you're getting insulin resistance to a point you're going to get diabetes 2. And with this, we begin now to find various ways where we can pick that up. We call this the metabolic syndrome at this point. Metabolic syndrome can occur with type 2, and also with 1. There's a commingling of products that have to be changing when you have type 1 or type 2. And so you really got to, as a physician, have to think about the fact they're getting tired, maybe a growth spurt if it's type 1. We have a situation where they're just having other things happen that they just think they're dying from the fatigue. This is an awful thing. And this all is part of when you're wearing it out. And when you get to 80, 90% of the insulin destroyed because it just couldn't make it that fast anymore, it's exhausted, that's when you have diabetes 2. Then there's a whole range of other new things that can regrow the cells, stop the insulin resistance, and that's the allopathic way to look at it. But still, you're looking at the arginine to bring everything metabolically back to normal, the D to have the integrity of the arteries where it is, and all the other things that you've heard about to make you health in terms of alkalinization and that situation. So this does a tremendous amount to prevent complications of diabetes. People don't die of diabetes anymore. We used to die, just sugar's too high, couldn't get it down, you die. Now we die of the complications. You live a longer while, you may lose body parts, you may have to have indecent things done to the back of your eye and a variety of other things. That's part of maintaining things, but you can change it all with the products we're talking about. The Pro-Arginine Plus, the D, keeping your oxidation good, and alkalinization of your urine perfect. So really, there are two names, different approaches, but it's really the same basic underlying disease, diabetes.
And with the diabetes, how would the inflammation issues with regards to what, say, the Mystica would provide and the alkalization from the core greens, how would that assist in slowing down the aging process?
Well, the aging process is inflammation at its core. That's it. It occurs in multiple ways, and we always refer to diabetes as accelerated aging. And it's part of all the panoply what I talked about, and the ability to step right up and do the V3 and little d in addition to this, and you've got something really good to prevent advances of complications.